Hello guys, today we are going to discuss the dental caries we are going to talk about the very important topics in LDC part 1 examination. The question is very important topics because every exam a lot of question will be going to ask from this topics, especially dental caries, because it is highly prevalent dental disease in the Australia. Let's start. Pathology and diagnosis of dental caries. Dental caries tooth decay is a pathological process resulting in localized destruction of tooth tissue. Dental plaque, a complex biofilm of mixed bacteria and their byproducts. It is a prerequisite for dental caries development. Frequent exposure to dietary sugar and carbohydrates leads to increase in population of carcinogenic bacteria and biofilm. Carcinogenic bacteria also produce organic acids which lower the pH of biofilm, result in enamel demineralizations, loss of carbonated hydroxyapatite. The stage of dental caries and sequelae. This is here a beautiful picture is given here and elaborate the stage of dental caries and sequelae. First, this caries occurs in the one indicates the white spot, caries white spots. This is very important, and later we'll discuss about the white caries spots, because in ADC lots of questions are asked giving the picture about caries white spots. What we will do in such cases? If there is a caries white spots, we are not going to replace this caries white spot. We just give them the remodeling agent like fluoride. Now in 52nd to this initial cavity, if this occurs initial cavity, now you have to restore this cavity, this large cavity involved in the folds, and fourth the periapical abscess. This is the simplest things, and evidentists know this equally very easily, so that I skip this explaining about that. Now earliest caries lesions and cavities, and earliest caries lesion white spots and cavities. Earliest caries lesions present as a white spots on the tooth that have a relatively intact surface. Early diagnosis of caries lesions maximize the opportunity for their arrest and reversal. They can be accurately assessed and monitored by either traditional method, visual and radiographic techniques, or newer technology involving laser and light-induced fluorescence. Okay, this is very important, and lot of beautiful information has given regarding the management. Only caries lesions present as a white spots on the tooth that have a relatively intact surface. Since this is a relatively intact surface, so that can be arrest and reversal. Okay, this is very important. If in the exam, the what will be the management of exam question can be asked in a such a way that what will be the management of this early caries lesion or white spots, then answer must be the arrest and reversal by application of the topical fluoride. Okay, we are not going to remove this white spot. This is a blunder mistakes. Now this also any question can be asked in a such way that how you detect or how you accurately assess and monitor this such white spots. There are two methods, either traditional methods by visual and radiographic techniques. Most of time we will assess by these traditional methods, or we can use newer technology involving laser and light induced fluorescence. Continued surface demineralization lead to cavitations. If untreated, cavitation gradually progresses through the enamel and dentin towards the pulp, and leading to pulpitis, pulp necrosis, infection of root canal system, apical periodontitis, periapical abscess, spreading odontogenic infections. Okay. Now another important, very important topics. This is called dental caries risk assessment. Dental caries risk assessment involve quantification of risk factors such as diet, saliva quality and quantity, plaque characteristics, oral hygiene habits, and use of fluoride products. Oh, this is very very important because everything has put in this sentence. Here it elaborates dental caries risk assessment involves quantification of risk factors. There are a lot of risk factors for dental caries, and if you read TG in the first chapter TG, they say TG said that we have to find risk factor, identify the risk factor, and we have to modify the risk factor if possible to in the course of disease management, so that in dental caries we have to manage dental caries properly. For that we have to also identify the risk factor and modify this if possible, and this is very very important for recurrence of disease and initiation of new disease. Early modification of these factors is part of primary preventive strategy. Okay, of dental caries management strategies. Prevention and minimal intervention management of dental caries before cavitation has occurred can involve several strategies that promote remineralization and arrest further decay. Individualize the management approach by tailoring strategy to patients' risk factors such as. Here it clearly defined that individualize the management approach by tailoring all the strategies. Okay, most of candidates fail to identify the individualized management approach because in questions not same, all different question in different case scenario exists. So in some case there is a poor habit, in some case there is a highly sugar in diet, in some cases there is a decreased salivations, decreased saliva, and according to that you have to find the main risk factor because because all the case scenario there is not same risk factor, so that it should be individualized. And I will provide beautiful questions SQs regarding this individualized management approach, how this question acts in individualized manners. Okay. First, there is a dietary modification, avoiding sucrose in sticky forms and limiting other sugars, acidity drinks, and carbohydrates snacks between meals. It clearly defined that you are avoiding sucrose in sticky forms and limiting other sugars, acidic drinks like Coca-Cola, and carbohydrates snacks between meals. Plaque reduction by cleaning the tooth, brushing at least twice a day with toothpaste containing fluoride, interdental cleaning, flossing, preferably immediately before brushing. Okay, the question can be asked: brush, interdental floss should be done before or after the flossing? Okay, then you get the answer: interdental cleaning, flossing, preferably immediately before the brushing. Okay, that's very important. The sequence of brush and floss is floss before brush. Simple. Tooth surface modification using remineralizing agent, e.g. fluoride. There is only two remineralizing agent, that is fluoride and guess what, CCP, SCP. Okay, placing fissure sealants and other adhesive metals that protect tooth surface. Saliva modification, addressing cause of dry mouth. We already know that we have to find the cause of any disease. Okay, during the course of management of disease we have to identify the disease, we have to confirm the disease, then we have to find the cause of disease. This is very very important. Without finding the cause of disease, we cannot manage the disease properly, and it can be cause of the acute case, can be goes to the chronic if you don't find the cause of disease. Okay, using low acid sugar free chewing gum or lozenges or non-acidic coarse foods, carols to increase salivary flow and buffering capacity of saliva. Additional strategy for patients at elevated risk for dental caries included isolated or higher concentration fluoride products, non-fluoride remodeling agent, chlorhexidine, performed through assessment of the patient age, other medication, disease risk, and use clinical judgment to determine appropriate individualized management strategy. For now, TG highly focus on perform through assessment of patient age, other medications, disease risk, of the medication that are responsible for dry mouth, lot of antidepressants dose is responsible for dry mouth, which ultimately increase the risk for caries, and certain disease like Sjögren's syndrome, anxiety disorders, and asthmatic can be responsible for the candidiasis, not a dry mouth. And that's very important, and use clinical judgment to determine appropriate individualized management strategy. Okay, keep in mind, always, okay, don't jump directly on the floor application, don't jump directly on the twice brush, don't jump directly on the chewing gum. Always think critically, use clinical judgment to determine appropriate individualized management strategy. TG frequently again and again telling that use clinical judgment to determine appropriate individualized management strategy, because all patients are not same and all patients have do not bear the same risk factors, and some used to take more sugary fruits, some do not brush, some do not use fluoride in their water. These are very different in situations, so that we use clinical judgment to determine appropriate individualized management strategy. Now, if the cavitation has occurred, the above chapter was relating to the prevention and minimal intervention management dental caries before the cavitation has occurred. That is, if a question asks about the early caries, white is false, then you look about this risk factor and which is most important, and you have to modify this. Okay, now cavitation has occurred, then what is the next option? Remove the infected tooth structure and restore the cavity using minimally destructive methods and adhesive dental materials. It talks about remove the infected tooth structure and restore the cavity using minimally destructive methods and adhesive dental material. That is, that two types of decayed tooth structure, that is infected and affected. We are going to remove only infected tooth structure and leaving them leave this there's affected dentin, and restore the cavity using minimally dystopic methods. That we only remove infected, not affected, and you use adhesive dental materials, that is composite and GIC in certain cases. This is all about today, and explain dental caries topics briefly. And now you have to understand that dental caries is very important topics. Almost in every exam, lot of questions are going to ask from this chapter, and we have to know that so then prevention and minimal intervention management of dental caries, like dietary modification, plaque reduction, tooth surface modifications, saliva modifications, because these can be cause of the dental caries, and according to the individualized risk factors, and we have to modify all of this, either dietary modification or plaque reduction or tooth surface modification or saliva modification. Next sector will be fluoride, and I will discuss in fluoride very briefly, and one time if I describe fluoride in such a way that you will never forget.